Imagine turning 2 minutes into 12, not with gimmicks, but with proven strategies seniors can trust. Because lasting longer isn't about chasing numbers. It's about confidence, closeness, and control. On average, sex from penetration to climax lasts about 5.7 minutes. And honestly, that's perfectly normal. Some surveys show couples would prefer it last between 7 and 13 minutes. But here's the truth. If you and your partner are both happy with the time you share, there's nothing wrong and nothing you need to change. The problem is when ejaculation happens earlier than you or your partner want, leaving you stressed, frustrated, or even avoiding intimacy. Doctors call this premature ejaculation, and it's far more common than most men realize. Nearly 30% of men experience it, but only a small fraction ever talk to their doctor. Today, we're going to break it down simply: what premature ejaculation really is, why it happens, especially as we age, and most importantly, the proven steps seniors can take to regain control and extend their intimacy without gimmicks or false promises. For many men, especially after 50 or 60, finishing too quickly in bed feels like a personal failure. But let's clear this up. Lasting shorter doesn't mean something is wrong with you as a man. Doctors use the term premature ejaculation, PE, when 3 things happen. You climax within 1 to 2 minutes of penetration. You feel like you can't delay it no matter how much you try. And most importantly, it causes distress, anxiety, or tension for you or your partner. It's also important to know there are 2 types of PE: primary, lifelong. You've had this issue for as long as you've been sexually active. Secondary, acquired. You used to have normal control, but at some point in life, ejaculation started happening faster, often within 3 minutes or less. And here's something that surprises many seniors. PE is not rare. Studies show nearly 30% of men struggle with it, yet only about 9% actually seek medical help. Most men try to fix it themselves, sometimes using 5 or more methods, before ever talking to a doctor. But understanding the root of the problem is the first step. And that means looking not just at timing, but at the biology of how ejaculation works. Ejaculation isn't something you decide to do, it's actually a reflex. Just like blinking or sneezing, it happens automatically once certain signals build up in your body. Here's how it works step by step. Stimulation begins. Friction and touch send signals from the penis up the nerves. The spinal ejaculation center, in the lower spinal cord, acts like a control tower, combining these signals with messages from the brain. If excitement builds too fast, the reflex is triggered and ejaculation happens, often before you're ready. One key player in this process is a brain chemical called serotonin. In men without PE, serotonin acts like a brake pedal, slowing things down. But in men with PE, these serotonin receptors don't respond as strongly, so the brake system doesn't work well. The result? The reflex fires sooner than you want. For seniors, there are often extra factors on top of this. Hormonal changes with age can affect sexual response. Circulation issues common in diabetes, high blood pressure, or heart disease make arousal patterns less predictable. Medications for blood pressure, depression, or prostate problems can alter sensitivity. Stress and anxiety, especially the pressure of needing to perform, can send signals to the brain that actually speed up the reflex. Before you even think about sprays or pills, there are several simple, natural techniques that can make a real difference. And the best part is, you can practice them at home, often with your partner's support. The very first step is communication. Many couples discover that intimacy isn't measured only by penetration or by lasting a certain number of minutes. It's about closeness, touch, and pleasure. When you and your partner talk openly, the pressure to perform often melts away, and that alone can reduce premature ejaculation. One of the best studied techniques is called the stop-start method. Here's how it works. When you feel yourself getting close to climax, you pause. You stop stimulation, take a deep breath, and wait until the urge passes. Then you begin again. Over time, this retrains your body to delay the reflex and builds confidence in your control. Another option is the squeeze technique. With this method, either you or your partner gently squeeze the head of the penis right before climax. That small pressure reduces arousal enough to hold off ejaculation. It may sound simple, but many couples find it surprisingly effective, and it also creates a sense of teamwork. Then there are pelvic floor exercises, also known as Kegels. These exercises strengthen the muscles that control urination and ejaculation. For seniors, the benefits go even further. Stronger pelvic floor muscles improve bladder control, core strength, and overall stability. With just a few weeks of consistent practice, many men notice a real improvement in their ability to hold back. Sometimes natural methods alone aren't enough, and that's perfectly okay. Medicine has developed several proven tools that can help men last longer and feel more in control. The first category is topical treatments, often called delay sprays or creams. These products contain mild numbing agents that reduce sensitivity in the penis, so the signals traveling to the spinal reflex center are slowed down. That extra buffer gives you more time before climax. One of the best studied products is Promescent, a metered dose spray that you can buy over the counter in the United States. In a clinical study, men who used Promescent increased their average time from about 6.5 minutes to 11.5 minutes. Even more interesting, partner satisfaction also rose significantly. Orgasm rates went from 44% up to 66%. And because the spray is absorbed quickly, there's little risk of transfer or numbness for your partner. There are also prescription options. In the US, doctors sometimes prescribe EML cream, though it's technically off-label for PE. While in Europe, Forticin is an approved treatment. Both are fast-acting and effective, but they require a doctor's approval. The second category involves oral medications, especially antidepressants called SSRIs. These include drugs like sertraline or paroxetine, which work by increasing serotonin levels, the very chemical that helps slow down ejaculation. They aren't officially approved for PE, but doctors prescribe them because one of their side effects is delayed climax. The downside is that they must be taken daily, and it can take 1 to 2 weeks before results appear. Common side effects include tiredness, mild stomach upset, or sometimes reduced sexual desire. There are also on-demand options. For example, clomipramine, an older antidepressant, can be taken a few hours before sex and has been shown to extend control. In some countries, a short-acting SSRI called duloxetine is available and designed specifically for this purpose. Beyond these, doctors sometimes consider off-label treatments. One is tramadol, a pain medication that also affects serotonin, though it carries risks of dizziness, nausea, and even dependency if misused. Another is alpha blockers, typically prescribed for prostate problems. They may help with PE in some cases, but they can reduce the amount of semen released, which some men find bothersome. Aging doesn't mean giving up intimacy. It doesn't mean your best moments are behind you. Premature ejaculation isn't a flaw, and it isn't a weakness. It's simply how your body's reflex system works. And like any system, it can be guided, retrained, and improved. You've now seen the full picture, from simple techniques like stop-start and Kegels to sprays, medications, and even therapy when needed. But the real message is this: lasting longer is not about numbers, it's about confidence, closeness, and joy. So if you've been struggling, don't give up. Start small, breathe, practice, talk, get help if you need it. Because lasting longer in bed isn't just possible, it's within your reach at any age.